Hello. Welcome in for your cranial nerve exam, right? Okay, perfect. So, as you probably noticed, I have one glove on today. I want you to just focus on the non-gloved hand. Focus on the hand that doesn't have a glove on, okay? Perfect. Now I want you to focus on the hand that does have a glove on. Just seeing how quickly you can keep up. Okay, can you hear this? Can you hear this? This, 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 and this. Okay, perfect. Can you feel this? Just close your eyes for me. Can you feel that? Okay, was that wet or dry? That was wet. Very good. And keep your eyes closed. How about? Can you feel that? Is that wet or dry? It is dry. Very good. Okay, how about now? Wet. Good. And now, wet again. Very good. One more time. One more time. Is that wet or dry? It is dry. Thank goodness, because you'd probably need to get a new shirt. Okay, so you can open your eyes now. I have two different sticky balls. One is blue and one is green, but the blue one is not in the hand with the blue glove. So I want you to go ahead and focus on the blue ball, not the blue glove, the blue ball, okay? Okay, I want you to tell me how many times I squeeze it. Don't focus on the green one, okay? Okay. How many was that? 8. Okay, now I want you to focus on how many times I squeeze the green ball, okay? How many times was that? 5, I think. Okay, just follow the green ball, ignore the blue ball. Follow the green, ignore the blue. Very good. Okay, how many fingers am I holding up? 2. How about now? 3, and now 1, and now none. Very good. Okay, we're just gonna check your number reading ability. Can you tell me what number is that? 133. 133. Okay, how about this? 121. And this thing gets so tangled. How about this one? How about focus camera? 71. 71. Okay, like there's a whole knot. Okay, and how about that one? How about that one? 25. 25. And this one is 2. Okay, so I'm glad you know your numbers. I'm gonna do some light triggers just so you know. So I have 2 different colored lights. They are on the brighter side. Okay, hello. Sorry, there's a couple different modes. So I have this colored one and then this not colored one. So I want you to just focus on the white one, okay? Okay, just focus on the white light. Focus on the white light. Okay, I want you to look at my nose. Tell me which one you see, either the red one or the white, okay? Red, white, red, white. Do you by chance remember how many times you saw the red light? Not including this time right now. 4. How about the white? 2. Okay, good. Focus on the white one down here. Tell me when you can see the red one. Come into your peripheral, okay? Just focus down here. Tell me. Good. Okay, go ahead and focus on it up here. Focus right up here. Tell me. Good. Okay, just keep focusing on the white light. Ignore the red one. It's gonna do some crazy stuff in your peripheral vision. Just ignore it, okay? Don't look at the light because it's very bright. Just look at the white one, which is also bright. So, there you go. Okay. Cool beans. I'm just gonna go ahead and put some eye drops in your eyes. Can you just open your eyes, okay? And I'm just gonna. Okay, and then here. Okay, which eye did I put more? Did I put more in your left eye or your right? Your left or your right? Your left or your right? The left one had 3 and the right one had You need a couple more though. You have really dry eyes, so we'll go ahead and we'll start with the right one here. So, okay, and then here we go. Okay. So which one had more that time? Was it the left? Excuse me, that's my left. The right or the left? The right or the left? It was the right. It was 5, 5, 5. And then how about the right? It was 3 again. It was 3 again. Very good, very good. Do you by chance remember those balls? What color were they? Green and blue, green, green, green and blue, green and blue. Okay, I'm just gonna say some things to you and I want you to kind of just repeat it, okay? Okay. Hippoplatypus football. Hippoplatypus football. Good, good, good. Okay. Glove. I'm not sure what else to say. Glove. I'm not sure what else to say. Okay, very good, very good. Like and subscribe. Like and subscribe. And I'll see you next week. Okay, very good. Bye. Howdy there, patient 2297. I'm going to go ahead and do your outtake assessment and see what we're working with here. So you don't have to do anything for me. Right, let's see here. So it says you are getting a lobotomy. Great. Lobotomy. I guess not so great in your case. 2297. Verified presence of body. All extremities are still in. Head is intact. Love that for me. Okay, I'm just gonna go ahead and see if we have any vitals there. Okay. Hair color. Eye color. Okay. Great. Alright, patient 2297, I'm going to get a picture of you here first before we get started. Say cheese. 1, 2, 3. Okay, another one. 1, 2, 3. And I'm just going to manually turn your head that way. Okay, and 1, 2, 3. Perfect. Let's just turn you back. Thank you. Okay. So, since there's no vitals, just to double check everything because that would be frightening, honestly. Just breathe normally for me, patient 2297. Okay, good. Just as intended. Check the back for good measure. Okay, perfect. Let me take your arm here. Let's see. Here. Okay, perfect. We can go ahead and check for rigor mortis. Do is just pop you with this hammer. So I'm going to take your arm there, patient 2297. All right. I'm going to walk you through everything, sweetie. You are in good hands. So, sorry, that was probably hard. You might bruise a little bit. It does happen more often than you would believe. Okay, ready? 3, 2, 1. Perfect. Let's do that again. 3, 2, 1. Okay, so arms seem good. I'm going to move down here to your legs, okay? 3, 2, 1. 3, 2, 1. And this leg. 3, 2, 1. 3, 2, 1. Sorry, that is my floor. Okay, let's just do the... I think I might be losing my hearing. Let's see, can you smell this? I hope you can. It smells like rotten eggs. Okay, I'm just going to put this solution on your skin. It's going to help preserve you a little bit better, keep your color. Okay, let me just turn your head the other way, behind your ears, and turn you all the way, get your other ear. Okay, turn you back. Let's do a little more in your hair. You wouldn't believe the amount of people whose scalp is just falling off by the time they're ready. Okay, so while we're letting that process, I do want to take a couple measurements of you. Nothing too major. I just want to make sure everything is even And in case there's anything that changes over the course of time, I can double check it for you to make sure you're ready when you are going out for your big day, okay? Yeah. Anything for you, patient 2297. Okay, perfect. Just double checking your nose here. It's looking to be about there. Okay, your lips. I would tell you to relax your jaw, but you can't. Rigor mortis is set in there, so we're just gonna take your measurement with your jaw. Just as it is. It's okay. That's okay. Yeah, I noticed when I was turning your head back and forth, it did feel like you were gonna lose it, but to be fair, they did a lobotomy before, so I don't know how much is my doing. I'm gonna check your teeth. If you have a dead tooth right before, it can smell horrible, so I'm just gonna try my best to open your mouth as much as possible. Like I said, rigor mortis is set into your jaw, but maybe I can break it. Thank you. Okay. So far, it smells like there's something. Did you have like onion soup for lunch before? You know you're not supposed to eat anything before surgery, right? That could be the issue, you know? That could have been what did it. Okay, I'm just gonna, since I have your mouth open here, let me get this one a little pokey. Just, no, I'm not a dental hygienist or a dentist, but I do go to the dentist, so I think that qualifies me to do a little touch up in case, you know, your jaw's stuck forever now. Okay, that's good. Let me just double check. Love that for you. Okay. So I'm just going to close your mouth, and we can do a little bit of reprogramming on you. So first I'm just going to see if there's any movement in you as I do this. Slower and then more rapidly. Rapid. We can go this way as well. Okay. I don't know why this one keeps glitching. Alright, so I'm just going to point to a color, and if you feel compelled to tell me, just shout it out, okay? Interesting. Okay, I'm gonna put these eye drops into your eyes. There we go. Perfect. I would tell you to blink, but I think I'll manually do that for you. Just massage a little bit into your eyes. Perfect. And you are good to go. Thank you so much for being such a lovely patient, 2297. I'm so sorry that your lobotomy did not work out, but I appreciate you spending the day with me at the morgue. I'll see you when your family comes for your funeral. Good night. Hello. I hope you're doing so well. We're going to be doing a cranial nerve exam, but you need to close your eyes. So while you're doing that, I'm going to put on some gloves. I have a standard latex, and then I have a fun tactile dog grooming glove that I'm going to put on my other hand, okay? So I want you to just hear the difference. Okay, so this is the latex, and then tell me which one I'm making noise with, okay? Dog glove. The latex glove, good. Latex glove. Good, dog glove. Okay, and just count how many times I poke your face. 3, 2, 1. 6. Very good. I'm going to slide that glove off. Slide that glove off. Now, keeping your eyes closed, I have a fairly bright light, and I'm just going to shine it very close to your eyes, and I want you to tell me if you can see that. Okay, good. So just tell me how many times it goes across your vision, okay? So, starting now. 1, 2, 3, 4. Good, 4. Okay, and now. 1, 2, 3, 4, 5, 6. And what was the difference between the first time and the second time? The first time was left and right, and then the second time was up and down. Very good. Okay, I'm going to switch lights now. I have some colored lights. So we have a blue light. Just shining the blue light over your eyes for you to see. Okay, can you see that through your eyelids at all? Okay, and then green light. Just shining the green light for you to see. Alright, so just tell me which light you're seeing, the green or the blue. Which light are you seeing? Green. Which light are you seeing? Blue. Very good. And which light? Blue. And which light? Green. Which light? Green. Okay. And I want you to just tell me, do you notice anything different about the blue light than the green light? So here's the green light going back and forth. And then here's the blue light going back and forth. Do you notice any difference? The blue light is blinking. Very good. Okay, I have a tuning fork. Can you hear that? Okay, good. Just tell me if you can hear it. Okay. Can you hear it? Alright, good. And good. Quieter now. And louder. Louder. Very good. Alright, hearing seems good. So I have a wooden ruler here. And I'm just going to be running my nails along this one. Tap, 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 or scratch, scratch, scratch. Just tell me which one I'm doing. Either tapping or scratching. Okay, so keep those eyes closed. And listen, listen, listen. What am I doing? Scratching, scratching, scratching. Good. And now what am I doing? Tapping. Good. One more time. What am I doing? this bright light we were using earlier, I'm going to cover one side or the other, and I want you to just tell me what side I'm covering, okay? So, what side is covered by my hand? What side can you not see the light on? The left. Very good. But now, what side can you not see the light on? The right side. Very good. Again. What side can you not see the light on? The right. Very good. One more time. What side can you not see the light on? The left. The left. Very good. Okay, keeping your eyes closed, I want you to tell me if you can see the light in the top, the bottom, the right, or the left, okay? I am going to switch lights, though, I think, to the brighter one. So, keeping your eyes closed. Now, what side is this light on? The right. And now, bottom. And now it's on. The top, the top, the top. And now, bottom. And now, and now, the right. How about now? The top, and now the bottom. I'll give you a break for just a moment. Now with this brighter light, again, I want you to tell me how many times it passes across your vision. Okay, so let's just 1, 2, 3, 4, 5, 6, 7, and now up and down. 1, 2, 3, 4, 5, 6, 7, 8, 9. Good. Again. 1, 2, 3, 1, 2, 3, 4, 5. Very good, very good, very good. Just relax your eyes. And to end with, we're going to do some more colored lights. So I want you to just tell me if you see the light as solid or flashing, okay? Flashing. And now. Solid, good. Now. Flashing. How about now? Solid. Now. Solid still. Flashing, good. Flashing. Very good. Alright, if you liked that and you would like a longer edition, let me know. And if you would like specifically eye only, closed, let me know and I'll make that for you too. Thank you so much for watching to the end. I hope you have sweet dreams and sleep well, and I'll see you in a couple days. Good night. If you actually wouldn't mind being my note keeper, I'll let you know anything that's of like super importance. Otherwise, if you have any questions, let me know at any point. I'm gonna kind of just focus on the patient though, so it doesn't seem like I'm just talking to you, okay? Okay, perfect. Yeah, go ahead and come on in. How are you doing today? Gotcha, yeah, so we've been having some headaches again. Okay, well, get comfortable. We'll see what we can do, okay? I am training today. I'm going to be hands-on, though. They're just going to be standing off to the side, taking some notes for me. Is that okay with you? Okay, perfect. Do you have a preference on gloves? I personally like the black ones, honestly, but if you feel like your hands are smaller, the pink ones are good. If their hands are bigger, the blue ones. Blue, just in case. Yeah, totally. I get it. Okay, I'll throw those ones over there. So you said you started to get headaches again. Did you get those blue light glasses like we talked about? Okay, and you feel like they were helping? So did you stop using them? Yeah, kind of. No, I get it. I also look at screens quite often and really bad with wearing mine too. So I'm not judging. I'm just trying to get a baseline for us here. Okay, so you can put that they've been in for headaches in the past. Do you feel like they're worsening, better, about the same as before? About the same. Okay, so at least it's not worse, right? Try to look at the positive here. Okay, and are you getting them more frequently than before? About the same, only like once in a blue moon. Okay, yeah, so about the same, like the once to twice a week. Okay, yeah, so you can put that everything is the same as the last appointment because they were here a couple months ago. Yeah, unfortunately this has been a reoccurring thing, right? Okay, so we'll do a little bit more focused on your eyes today, of course, but we will do a full look over for you. I personally like to start top to bottom just so I don't forget anything. However works for you, though, you do it, okay? So we already covered the headaches. Any eye strain that you're noticing? Any like floaters in your vision, double vision, blurred vision, anything like that, really? Okay, so no changes in the vision so far. Okay, good. No issues with bright lights, sunlight, direct light, anything like that. Okay, I am gonna shine some lights. I figured you already knew. Yeah, of course. Okay, perfect. So do you want to start with the lights or do you want to start with something else? Okay, why don't we start with the sense test then? So just with my gloves, first I'll touch your face in various places. Just tell me when you feel it, okay? Close your eyes for me. I just like to palpitate all around the face and make sure that I can feel. Go to my nose here. Good. Okay, can you turn your head to the side? I'll feel along your neck. Yes. Turn to the other side. Thank you. All good. Okay, you can look back at me. Thank you. So let's go ahead and now use our devices. That's actually a little long. We're not that far away. So just tell me when you feel me touch you with either the cool metal or I have this. Okay, so just let me know what you're feeling. The metal. The blue file. Blue file. Metal. The metal. What's going on here? Blue file. Blue file. Very good. Okay, so all of feeling is good in their face. And I didn't feel any lumps or bumps or anything like that. It will feel your lymph nodes in a little bit, but you haven't had any discomfort with that, have you? Okay, good. All right, so back to your eyes for just a moment, if you don't mind. I am going to shine this light. You can just look right at my nose, please. I'm just looking to see if there's any irritation in their eyes. You'll have a checklist to go over, so you don't have to worry about anything, like forgetting anything. But I'm just making sure that, can you just follow the light, please, love? Thank you. Making sure that there isn't anything that's really standing out at the moment. Because if that's the case, we do want to get them sent for an MRI or a CT, depending on results, okay? Okay. But you're doing great so far. No worries. Don't want to stress you out. You're doing perfect. You don't have to worry about a thing. If you want me to tell you already what I'm thinking, I don't want to nag you, but I do think you need to get better with wearing the blue light glasses. And I do think you need to drink more water. But we're going to go through all the tests. Don't you worry. I am taking it very seriously. So I have a new light from last time that you were here for your cranial nerve exam. It is quite bright. So yeah. Just look at my nose for a minute. I'm just going to shine it in the corners of your peripheral vision. Just let me know if you're seeing it, okay? I want to make sure we don't have any blind spots here. And if we do, we can get that addressed, okay? Yeah, last time when they were here, there was no visual issues, but we just want to make sure that we're keeping the same baseline, especially if it is a reoccurring issue that they've had. Sorry, I know I keep looking at you as I'm talking to them. That's probably a little confusing for you. You're doing wonderful though. Thank you so much. I know sometimes, especially like when I'm the patient on the end of somebody training, I get a little bit nervous just because I want to be a good patient for them. That way they can train well. But then when I'm the trainer or the trainee, I don't care at all. I just want to make sure the patient's comfortable. So it's funny how the roles reverse, but you've seen this okay in every spot. Okay, let me shine. That one was a little high, huh? There we go. Okay, good. If you can, try to follow the light just across to your vision. If you can't, no worries, okay? A lot of times, yeah, right there in the middle, it gets really bright, I know. A lot of times, I can't even do this one. I have a bit of a light sensitivity myself, though, so that's why I was leaving you open for the challenge here. You're doing so well, though. Good job. Go in circles here. I don't want to make you dizzy at all, but are you noticing that your eyes are hurting at all? Any strain? Are you getting any sort of headache or anything? Okay, so we can rule out that it is from bright lights at least, although I will say extended light exposure is not ruled out. So now we're going to do a bright versus dull test. So either bright light or the dull light. I do think I'm going to take off this otoscope portion though, so that way we can see a little bit better, a little. Obviously you can tell the difference, right? So just tell me, I'll have you focus on my nose for this first test. Bright, dull, dull, bright, bright, dull. Good. When I'm doing this one, I want to make sure I'm not shining the bright light super bright in their eyes, so I will keep it towards the outside of their vision, and then for the duller light, I will bring closer. Okay. So just those little nuances I like to let everybody know in their training, because I would hate to have this light shined in my eyes rapid fire. Bright one, dull, and bright, dull, 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 bright. But on the flip side, if I keep this one here, sometimes like I can't see that. Dull, bright, bright, dull. Very good. Okay, go ahead. Rest your eyes. If you need to close them for a minute or two, you go right ahead and do that. And I'm going to get set up on our next vision test. Non-lights, though. Okay. Yeah, you're doing okay. Good. So I have these colors here. I'm going to point to a color. Just tell me the first thing that comes to mind. Hopefully it's the correct color, but if not, that's okay too. We'll address that. No worries. So let's go with this one right here. This one, this one, this one. Red, very good. How about this one? Purple, blue, yellow. I would argue it's more of an emerald green, but it is in the green column, so I'll give it to you. How about here? Orange, and let's do this one. White, and have you done any of these? Any pink, and this one. Blue. Lovely. Now, I have two of them actually. I'm going to give you a moment to look at them. Okay, just look at them. Okay, I'm going to go ahead and take them away now. And I want you to tell me, did you notice anything different about the backgrounds of the remotes? So the very first one I showed you, of course, it had the colors and everything, but there's a specific color on the background. And then I showed you the second remote, and it had a slightly different background. I'll give you a second. So the first one was all white. The next one had a blackish, almost gray background around all of the buttons. So just little tests like that you can do throughout to test their memory. And I'll also ask you to remember the color of the gloves that I offered earlier. We had the black ones that I'm wearing, of course, and then blue and pink. Good. Pink are smaller, the blue are bigger. Very good. Good job. That also can help if you have a concussed patient, making sure that they're remembering things correctly and seeing how severe it is. You're not concussed. We don't have to worry about that today. Try not to get hit in the head at all, though. So my gloves are tight, so they're going to squeak on you. Last thing I have here for your vision test is this. I know, it's kind of a weird prop to have. Don't get me wrong, I get that, but I'm going to have you focus on this now because it's a lot cuter than just staring at my nose the whole time. So look here, and I want you to just tell me when this light crosses over the ball. I will try to dim this a little bit for you because that was, that's better. It's still bright, I'm sorry. Alright, so I have it here for you. Just tell me, just in your peripheral. Very good. Your peripherals. Very good. Your peripheral. Good. Okay. We're just going to check all of the sides very quickly. So you've done a good amount of eye tests. We don't need to go. Good job. We don't need to go too overboard, but because they specified it was headaches. Good job. Down here. Because they specified it's headaches, we want to make sure we're checking and being very thorough. Good job. With their eyes specifically. Okay. So, you've been hearing me okay thus far? Yeah, okay, good. I do want to double check your hearing a little bit more though, okay, so you can hear it. That okay? And that okay? Yes, and how about? Yes. Hello. Goodbye. What did I say? Hello? Goodbye. Good. You don't have to leave this second. I just wanted to make sure you could differentiate. I do have the tuning fork, so no worries if you can't hear the frequency, but we're just going to check. Can we hear? Yeah, sorry that probably sounded louder on my glove. Okay, and do you feel like this time was louder or the last time? This time, yeah, good. All right, another feeling test just because I want to rule out anything, anywhere on your beautiful face. I have a brush that'll boop on you, or I won't spray you too much, I promise, but I do have a water. There's this weird condition where you cannot feel being wet. So I just want to rule out everything. One of the symptoms is headaches, and it's kind of invasive to test for it any other way, so I wouldn't spray you unless I had to. I'm not that mean, right? Okay, so close your eyes. Thank you, my love. All right, just tell me. Dry. Dry. Wet. Dry. Dry. Wet. 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 Dry. Dry. Wet. Very good. It seems like you can feel the dryness and the wetness. All right, love. So everything is looking good thus far. We're just gonna do another feel down your neck. I want you to open your mouth for me first, though. We're gonna look. Let me get this real quick, if you don't mind. Just thank you. Okay, no redness or irritation in your mouth. Okay, good. Keep your mouth open. I'm just gonna palpitate here. Okay, you can close your mouth. You don't have any issues with any of your teeth, correct? Okay, good. We're just gonna feel down your neck. Can you raise your shoulders and lower them? Good, okay. And you were able to turn your head fine earlier, but go ahead and turn one more time for me. I'm just gonna see any difference. Okay, and the other way. Thank you. No, all of that is good. All right, well, if you want to go in a giant tube, I can schedule you for a CT scan or an MRI, whatever tube you're feeling. Not yet, okay. Yeah, so honestly, my recommendation for now would be keep track of your water intake, just like in your phone, or keep a little tally anytime you're filling up your cup, things of that nature, just to make sure you're staying hydrated, because getting headaches is one of the first things when you're dehydrated, as well as making sure you're wearing those glasses more regularly. I would even look into a thicker one. Dim your phone, dim your computer, turn on the night mode yellow version, and watch some ASMR before you go to bed. And don't forget to like and subscribe. Okay. I hope you had a good day and that your headaches subside. Thank you so much for allowing me to train, and I will see you soon. Hopefully not under a medical condition though. Okay. Maybe some nice eye triggers. Eye triggers with lights. Okay. That'll make you nice and sleepy. Okay, good. Bye. Did you have any questions about anything? We can go over some more things. Hello. Welcome in for your physical. How are you doing today? A little nervous. Not to worry, you're in good hands. I've been working on this specific team for the last 5 years now with our extra special patients. So I like to work top to bottom. If you have any questions at any point, just let me know, okay? Okay, perfect. So let's start with your lovely eye. Now if you look at my nose, please let me know when you see this light come into your peripheral, okay? It's going to be a bit bright, but not too bad, right? Yeah, okay. Good. Perfect. Can you just follow it with your eye, but do not move your head, okay? Don't move your head. It make you a little dizzy here to start out with. Okay, perfect. So good. Now, if you wouldn't mind looking at this for me, just keep focus on this and let me know when you see that light come across it, okay? I'm just gonna come here, okay, and here, and here. Okay, lovely. Now, any pain or discomfort? Okay, can you close your eye? I just want to palpitate and feel. Okay, you can open your eye and take a look in your mouth now. Are we working with just one throat? Okay. That all looks clear. Can you lift your first tongue and your second tongue? You can put the first one down and the second one down. Any issues with your teeth? Okay. Just going to measure that scale on your cheek. We'll monitor it. Have you noticed any changes in it recently? Okay, I'm just asking because the borders are a bit out of the scope of what I like to see for facial scales, okay? Yeah, got no concerns right now though, so that's good. Okay, so I'm just gonna test your ears. Are you on frequency 2? Okay. Okay, perfect, so you can hear that? Yes, okay, so just let me know when you can hear the clicks, okay? You can close your eyes, it makes it easier for you. Lovely. Now I want you to tell me how many times I'm clicking it, okay? 5, good. 2, 3, perfect. Okay, no concerns with your ears, right? Okay, let's go ahead and move down to your hearts, actually. Okay, and you have 3. Okay. All right, so just breathe normally for me right now. I'm just gonna listen. Okay, oh, that sounds good. Your next one. The next one's back here. Okay, perfect. Those sound really good. So I'm going to listen to your lungs first and then we'll look over your gills. So I just want you to breathe normally the first couple of times here. And then I'm going to have you take a deep breath for me. Out. And in. And out. Okay. And you've been able to pass air through and water through and everything. Okay. Good. So let's go ahead. Look at your gills. Can you turn your head for me? Lift your chin up a little bit. I just want them to be stretched. Yeah, just gonna flex them a little. Okay. Any pain or discomfort when I spread? Okay. Yeah, they look really healthy. Go ahead and do the other side. Thank you. And have you noticed any sensitivity or irritants or anything like that? Okay, you can go ahead and look back at me and relax. Let's go ahead and move down to your legs first, and then I'll work my way to your tail, okay? So I'm going to check your nerves in all of your legs. So I'm just going to feel down all 5 of them, okay? Okay. 1, 2. Let's do 3 again. 3 is good, okay. 4, 5, okay, good. Yeah, sometimes when we're checking, we hit the nerve a little bit off, and we just want to make sure that everything's good. So you had mentioned to our nurse that you're having some issues with your tail scale specifically, correct? Yeah, you've had some itching. Okay, so I'm going to recommend you this. It's a really thick cream. I'm going to apply some right now. You can let me know how it does for the rest of our appointment. And I'll send you with this and then write you a prescription for more, okay? Yeah, you're welcome. I know it can be really uncomfortable to have itching on your scales. I'm just gonna get your tail here, get the underside. Is it concentrated just on your scales or is it also on your spots? Just on your scales, okay. Gotcha. Okay, I'm gonna do a little bit more just towards the tip of your tail. Okay, good. Right here. Good. Okay, perfect. I do need to get a temperature on you really quickly just to make sure. Okay, 12 degrees. Let's go ahead and test your face. So I'm just going to poke and prod at your spots just to make sure each one has feeling. Just let me know if any spot I touch does not. All of those are good. Lovely. Go ahead and hold out your arms for me. Same thing, okay? And those are all good. Okay, and this side. Good. Okay, and your legs. Little ones down here. Okay, perfect. All those feel good? Alright, good. Okay, so any questions, comments, concerns from me? Okay, so I will update your chart. You are free to go pick up that medication. I'll give you the rest of that to take with you. There you go. Let me know if you have any concerns in the meantime. Otherwise, I'll see you soon. Bye. Hello. Welcome in to your cranial nerve exam. How many cranial nerve exams have you watched today? 6? Okay. I would like to see you up that a bit. I've got quite a few. Just a playlist, up there if you want to check it out. But let's go ahead and finish what we're doing here first today. Okay, so any changes to your condition? Anything that I need to be aware of? Have you had any changes in your eyes? Your vision is visioning. Your smell is smelling. Your taste is tasting. Your ears are hearing. Okay, is your face feeling still? Okay, well, I'll be the judge of all of those, but it's good that you think everything is functioning as it should be, so that's always good. Okay, and are you still the same height? Have you been shrinking? Do you think that maybe I need to, if you don't mind, just stand up tall, okay? Let's see how big you are. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Oh, wrong way, hold on. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay, so you're about the same height. Let's go ahead and see how big your head is. Is your head growing? They measure babies' heads to make sure they're growing correctly. Okay, so let's see. Let's do centimeters. Don't mind me, sorry. You might want to close your eyes and just. Oh wow, you have such a big head. Good job growing that brain of yours. You're doing great. Okay, let's go ahead and while we're on this, I'm just gonna go ahead and look straight ahead for me. Let's see how big your eyeballs are. Okay, about 6 centimeters by 3. We got a 6 by 3 here. Okay, cool. Alright, so do you want to start with your feeling of your face? I have a chopstick here. You can just feel, yeah, it's not bad at all even. It's kind of unsanitary, but it's okay. You don't mind, right? We're on a deeper level than most patient doctors, right? Between you and me, I'm not really even a doctor. Okay, so here's what the brush feels like. Okay, your face is feeling that. So all I need you to do is close your little eyes. Close. Don't worry, you're in good hands. My hands. So close your eyes and tell me if you feel the brush or the stick. Okay? Keep your eyes closed. No cheating. The stick. Good. You can say chopstick if you want, or stick. What is this? What's that one? The brush. Very good. Let's go again. What's that one? The brush again, and now the stick. Okay, I'm gonna do one more time just because I want to make sure you're really feeling this. Okay, you are feeling it. That was stick. You are correct. Okay, so now let's check your nose. Okay. Go ahead and You know, sometimes you can like squeeze a bottle. I thought I could do that with this one, but it's fine. I'll just smell that, smell that. What does that smell like? It's lavender, lavender, lavender. Okay, let's do this one. This isn't the same bottle. It's a different bottle. It is a different bottle that looks exactly the same. Okay, so what does this one smell like? It's not lavender. Pine trees, pine trees. I love that. Okay, let's do one more. I like to do three. Okay. So go ahead. What is that? What does this one smell like? Chocolate. Okay. Now let's test your taste. So I'll only do a couple drops because this is essential oils and I don't want to make you sick or anything like that, you know. FDA regulations and stuff. But go ahead and taste that. Thank you. I did get it on your channel, just sorry. Get a little ahead of myself sometimes, you know. What does this one taste like though, my love? What is it? Sorry, what does it taste like? Yeah, cactus. Did you know that they tasted like kind of like water, like a earthy water? Yeah. Okay, how about this one? What's that one taste like? Dragon fruit, good. Okay, let's do one more, you know, I love three. Okay. What does this one taste like? Yes, the color white. It is. Okay, so let's move to vision. I have these fun little characters. We have an alligator and a baby chick. Oh, baby chick, and a baby alligator. So I'm gonna have you just test, or I'm gonna test your focus. That's what I'm trying to say. So go ahead and look at the alligator and ignore the baby chick, okay? Look at the alligator. Ignore the baby chick. Good. Which one is closer to you right now? Baby chick. Good. How about now? Alligator. Good. Go ahead and look at the baby chick. Focus. Perfect. Blink. Excellent job. Remember those cute little guys, okay? So I have 2 pen lights, okay? I am going to not flash them, but I am going to have one on and then switch like so, okay? So if that's gonna bother you, just skip a little bit. But I just want you to tell me which one is on. So either the left, this is my left, I think it's gonna be your right though. TikTok has me all confused. So either the left or the right, okay? You can look at my nose, don't look at the lights, okay? Ready? Good. Okay, now I would like you to focus on whichever light I say, so I'm going to have them both on here. I want you to look at the light on the left side, on your left, okay? So you should be looking at this bronze. Good. Okay, now you should be looking at the white light. You should be looking at the white light. Good. And back to the bronze. Good. Good job. Look at my nose. Tell me when you can see the light, okay? Okay. Look at the light. Look at my fingers. Look at my nose. Look at the light. Follow the light. Good. Close your eyes. Open. Look at my nose. Look at the light. Look at my tattoo. Look at my eye. Look at my fingers. Follow my fingers. Ignore the light. Follow my fingers and ignore the light, okay? Good, good, good. Good job. You're doing so good. I'm gonna shut off the light in just a second. Give your eyes a break. Perfect. Good job, my love. So, a couple more things. I'm gonna do a little bit of a number test with you. I think I'll use the chopstick for this one though. So, I'm gonna hold this here. We'll see if it'll focus. Sometimes the camera does, sometimes it doesn't. Alright, can you tell me what number is right there? What number is right there? Right there. Right there. Right there. There. I'm gonna flip it over. I want you to tell me, is point A or B closer to you? A, B, or C? A, B, C, or D? A, B, C, D, or E? A, B, C, D, E, or F? A, B, C, D, E, F, G. Good, one more. A, B, C, D, E, F, G, H. Good, 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 good. Good job. Let me know if you like going lower in the alphabet. A little tricky for you. Okay, so I have this plumber's tape, and I'm gonna have you focus in the center and let me know when you see the light come in. Come in, come in, come in. Let me know. Perfect. Just keep your focus. Good job. Right here. Nice. Alright, let's see if I can switch hands. Sometimes this does not go. Good, good, good. Right here. Good, 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 good. Alright. I'm just going to say some things in your ears, and I just want you to tell me what you hear. Cat, mouse, frog. Cat, mouse, frog. Good. Apple, horse, pig. Apple, horse, pig. Lots of animals on my brain. Okay. Alligator, baby chick, blue, green, purple. Alligator, baby chick, blue, green, purple. Good. Okay. Now I want you to tell me if you notice the snap is closer or further. Okay? Very good. Very good, very good, very good. Okay. Lastly, tell me how many fingers I'm holding up. How many fingers? 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 How many? How many? How many? Very good. Very good. And last thing. I know I said that was the last one, but this is actually the last one. Do you remember the animals from earlier that I told you to keep in your noggin? Do you remember what they were? Baby chick and an alligator. They're so happy you remembered them. Now I'm just gonna get an outtake picture of you. So go ahead and look at my nose. Look at my nose. Unclench your jaw. Look straight ahead at me. Just look at my eyes. Relax your shoulders. You're doing great. Look at the camera. Look at the camera. Okay, perfect. I hope you had a lovely time. Everything checks out. You are in good standing with all of your cranial nerves, just like you said. I would love to see you back for an eye exam, maybe sometime soon. I think that could be really good. And also, you said that you were having a little bit of issues with your attention span, keeping focus on things for long periods of time. So we're gonna do some ADHD test for you. Rule any of that out. That way we can get a treatment plan going for you. Okay. So eye test, ADHD, focus test, visual instructions. Anything else? Okay, well, if you think of anything, you can let me know down in the comments. Don't forget to like and subscribe and turn on the bell so you're notified when I post another video. Thank you so much for watching till the end. If you did, comment the frog and the chopstick emojis to let me know that you like the tattoo. Good night. I'll see you soon. Bye.